This is the second video on constipation and will discuss investigations. What are the complications of constipation? Small tears in the anus called anal fissures. This is an image of an anal fissure. As can be seen here, there's a small tear in the anus and is usually caused by a large or hard stool which is passing through the passageway. Then we have swollen veins in the anus called haemorrhoids. This image shows two types of hemorrhoids. One is the internal hemorrhoid and the other one is the external hemorrhoid. Straining when stool is passed can cause the veins in and around the anus to bulge, and these are called hemorrhoids. Rectal bleeding after straining is another complication. Hard stools that get stuck in the rectum can cause a mechanical obstruction, and this is called fecal impaction. This happens in chronic constipation when hard stools accumulate in the intestines. So these are the 4 complications of chronic constipation. When should a patient see a doctor? If the chronic constipation is not responding to diet changes or laxatives. Then if the patient has alarm symptoms suggest that a more serious medical problem is causing the constipation. These include fever, blood in stools or anemia, significant weight loss, which could indicate a cancer in the colon. The point at which unexplained weight loss becomes a medical concern is not exact, but many doctors agree that significant weight loss is more than 5% of body weight in 6 months to a year in an adult. If there is severe abdominal pain, if there are symptoms of blockage of the intestine where the abdomen gets very distended or there is vomiting, if there is inability to pass gas, if the onset of constipation in someone above the age of 50 years. And finally, if there is a family history of colon cancer or inflammatory bowel disease. What tests or investigations will the doctor do? First, the doctor will do blood tests, which would include full blood count, kidney test, blood calcium levels, blood sugar levels, and thyroid study. Sometimes the doctor might do a stools test to look for blood in the stools or colon cancer markers. Abdomen X-ray if blockage of intestines is suspected. Endoscopy called colonoscopy or sigmoidoscopy to examine the colon and rectum. These tests are usually done if cancer is suspected. In colonoscopy, a thin flexible tube is inserted through the anus, as is shown in this picture, and gently pushed through until it reaches the end of the colon. In sigmoidoscopy, the rectum and part of the colon is only examined. During these procedures, the patient is given some medication so that no pain is felt. The patient is asleep throughout the procedure. Sometimes the doctor may do a type of X-ray called the barium enema. This picture shows how the large intestine or colon looks in a barium enema. For this test, the patient will drink a liquid the night before the test, which will help to clear the intestines. The actual test involves a lubricant tube to insert a dye called barium into the rectum. It highlights the structure of the rectum and the colon. CT or MRI scan of the abdomen is done if more serious conditions like cancer or inflammatory bowel disease is suspected. In centers that specialize in the management of constipation, specialized tests are needed, particularly to diagnose the condition dyssynergic defecation. There are 4 tests that are done in this condition. One is called the colon transit test. This is a test to measure how long it takes for stools to move or transit down the intestine. The patient takes special capsules that show up in the X-ray. One or more X-rays are taken later to see how long it takes for these capsules to pass through the digestive system. You can see these markers which the patient has swallowed in this X-ray as is denoted by the arrows. It may take up to 3 to 7 days for the markers to all come out with a bowel movement. In dyssynergic defecation, the transit time is prolonged and it takes a very long time for all the white markers to be expelled in the stools. A test to measure pressure in the rectum and anus is called anorectal manometry. In this procedure, the doctor places a flexible probe into the rectum to measure the pressure within the rectum and anus. It takes about an hour for the test and is generally well tolerated. It measures the strength and weakness of the anal muscles as well as the rectal function, as is shown in this picture. A test to study defecation called the balloon expulsion test. This test involves inserting a device into the rectum. This device consists of a small water-filled balloon shaped like a stool, as is shown in this picture. After the device is inserted, the patient is asked to expel the device, which is the balloon, in private. This study studies the muscles of the pelvic floor and anus. If the patient is unable to expel the water-filled balloon within 1 to 2 minutes, the condition called dyssynergic defecation is suspected. Another test to study defecation is called defography. Defography is the study of a patient when he or she is actually passing motion. This test uses X-ray or MRI to study the pelvic muscles and defecation. A soft paste gel is inserted into the rectum, as is shown in this MRI image on the left side, which is white in color. The patient is then asked to expel the paste or gel. A scanner records the process of defecation as the patient is expelling the paste or gel. This test shows how well the stools can be held and released. A test for dyssynergic defecation is positive if the patient is unable to expel more than 50% of the gel or paste. So, in summary, the 4 tests that are done to study dyssynergic defecation are colon transit test, anorectal manometry, balloon expulsion test, and MRI defography. These are very specialized tests and are only done in a very few specialized centers that focus on constipation.